Every year, more than 1 million athletes end up in the emergency room.
And that's where the importance of sports medicine comes into play. Our friends at Spectrum Health Medical Group are having an online chat tomorrow afternoon so you can learn more.
Today, Philip Adler, an athletic trainer with the group, is here to talk about sports-related injuries. We know that you're affiliated with the Whitecaps. We also know that school started, so a lot of sports injuries are happening. What exactly is an athletic trainer that works with these athletes?
Well, an athletic trainer we're a health profession, or in the health professions, we're a licensed health professional, and we have excellent training to deal with prevention, diagnosis, and treatment of not only new injuries, but old ones that have been lingering for a long time.
Right. Now, school has just started, which means that a lot of the sports practices are starting. So, do you have any tips, and do you see a lot of treatment in the schools?
Absolutely. You know, there's the athletic trainers, we work in various settings, and the high school athletic trainer is essential to the team because they're right hands on deck. Really, they're the first person that a lot of these high school athletes will see. Moms and dads can rely on the high school athletic trainer kind of as the first contact, so they know, is this something that needs to go to the emergency room right away? Should I get in to see my family practice physician?
Right.
Where do I go? What do I do with this injury? And a lot of times the athletic trainer out at the high school will have great tips on how to treat and how to manage that injury. You may not need to go to the emergency room right away, but they're trained to deal with that, and trained to deal with concussions, and trained to deal with the heat illnesses and a lot of the hot topics we hear about. It's a great resource for moms and dads, especially those of them that have the athletic trainer at the high school.
So what are some of the typical settings that you work in?
You know, I would say one of the typical settings is the high school setting. It's very common. Collegiate setting, so we have athletic trainers in the college setting, pro sports. But there are also some really neat opportunities for athletic trainers coming up in what we call emerging settings. Fine arts, maybe the ballet or stage productions. Also the military is becoming a very popular place. The military is starting to hire some of these athletic trainers to come on board. There's industrial athletic trainers that may work at Consumers Powers, or maybe one of the auto industries, or some of the other places where instead of just going to workman's compensation, they see their athletic trainer first, so to help reduce costs there. And our training gives us an opportunity to do a lot of things in a lot of different settings.
Wow, now you said a lot of the local schools do have athletic trainers on site or on hand, but for those schools that do not yet have that training capability, do you have tips for the parents?
You know, we do. And one, we would encourage everybody to try to employ an athletic trainer in some way at their high school, whether it's on a part-time basis, and certainly the sports medicine program we're building with the medical group can help with that. If you don't have access to that athletic trainer, then there are things like the online chat that Dr. LeBolt is going to be doing tomorrow is one resource to use. Another thing is to work through your primary care physician, and then just to be educated about those injuries and whatnot. There are a lot of athletic trainers that are available in different areas, and certainly try to use us as best we can.
Yeah, so I'm a little bit curious of what kind of injuries you're seeing right now, and just kind of, you know, does that mean that some athletic trainers are more valuable in certain areas than others?
You know, I think it depends on where your training is. We typically will see your normal sprains and strains, and we deal with a lot of joint injuries, so your knee injuries and ankle injuries.
It's football season.
Absolutely, it's football season, but other than football, there are the other sports that are going on, and we don't want to forget about our girls who are doing volleyball, and basketball is around the corner as much as we kind of keep looking ahead. So all of the sports, there's the opportunity to deal with different things. Golf, tennis with the overhead, swimming. I mean, all of the sports, there's an opportunity for injury, and athletic trainers are trained to deal with the variety of things that come along. In addition to that, we also have some training to pick up some general medical things, and to understand the different illnesses and whatnot. They're going to come through our doors, and we can kind of guide our athletes to the appropriate professional to get some follow-up treatment if necessary.
Nice.
Great. So you have an online chat that's going to be happening tomorrow.
Yes, we do.
Tell us a little bit about that.
You know, Dr. LeBolt is an orthopedic surgeon with the medical group. He's comes to us from Virginia, and he brings a wealth of knowledge, having worked with James Andrews and the Andrews Institute in his background. He's going to be available to answer questions from moms, dads, people in the community. If you have a specific question about an injury that may pertain to orthopedics, a knee injury, an ankle injury, or if there's just a question you'd like to ask him from an orthopedic surgeon perspective, he's going to be available to talk with you online and get those questions answered.
What a great resource.
Really, too. And then I imagine a little bit with the weather changing, there was those concerns. It's just so broad. There's so many things to think about. You know, the heat was one of them. And so thank you so much for offering this resource to our viewers.
Well, thank you very much for having me. It's been a pleasure.
Thank you.
We'll be right back.
Are you West?